Every single morning, millions of people over the age of 60 sit down to what they believe is a carefully chosen, genuinely healthy breakfast. They read the label, they pick the box with the heart logo, they feel good about the choice they made. But what is actually happening inside their arteries during that meal is something I have seen the end result of more times than I can count on my operating table. My name is Dr. Emily Carter, and I have spent 12 years as a cardiothoracic surgeon. I have opened more than 1,000 chests in my career, repaired damaged arteries, performed bypasses, and held a living, beating heart in my hands. And today I want to talk to you not about the operating room, but about your kitchen, because what you eat in the first hour of the morning has a more powerful effect on your cardiovascular system than most people. And honestly, most doctors fully appreciate, especially after 60. Before I explain the mechanism, I want to tell you about a patient. I will call her Eleanor, 68 years old, a retired school teacher, meticulous about her health in every way. She walked every morning without fail, never missed a medication, attended every appointment, and asked every question. By any clinical measure, she was a model patient. She came to me after her second cardiac event in 3 years. Her cardiologist was puzzled. Her cholesterol numbers were acceptable, her blood pressure was controlled, her medications were correct, and yet she kept ending up in the hospital. I asked her to walk me through everything she ate in a typical day, starting from the moment she woke up. She described her breakfast with genuine pride: oat bran cereal with low-fat milk, a glass of orange juice, and sometimes a slice of whole wheat toast with a thin spread of low-fat jam. Every single item on that list carried a health label. Every single item had been recommended to her at some point by a physician or a dietitian, and together, eaten every morning for years, that breakfast was doing something to her arteries that her standard blood work was never designed to detect. Let me explain exactly what happens inside your body when you eat that breakfast, because the mechanism matters and understanding it changes everything. Start with the cereal, even the ones marketed specifically for heart health, the ones with oat bran claims and whole grain badges printed proudly on the front of the box. Turn it around and look at the back. Find the sugar content. Most commercial breakfast cereals, including the ones labeled healthy, contain between 8 and 20 grams of added sugar per serving, and most people pour more than one serving. Within 30 minutes of eating that sugar, your blood glucose rises sharply. In a younger body, that spike is managed relatively efficiently. After 60, insulin sensitivity has declined for most people, which means the spike is higher, the response is slower, and the damage accumulates in ways that are completely invisible on a standard blood test. Every sharp glucose spike drives a process called glycation, where sugar molecules attach to the proteins lining the walls of your blood vessels, stiffening them, making them less flexible, more brittle, and more prone to developing microscopic tears. And microscopic tears in arterial walls are exactly where plaque begins to form. I have seen the inside of those arteries. I know what a smooth, responsive vessel wall feels like compared to one that is rigid and calcified. That calcification does not happen overnight. It is the result of years of repeated glycation, inflammation, and oxidative stress. And it starts at the breakfast table. Now add the orange juice, and this is the detail that surprises people most, because orange juice has been the symbol of a healthy breakfast for 50 years. It is natural, it comes from fruit, it has vitamin C. All of that is true. Here is what is also true. An 8-ounce glass of commercial orange juice contains roughly 26 grams of sugar, more than many sodas per ounce, and it contains almost none of the fiber that slows glucose absorption when you eat an actual whole orange. The fiber in the orange is the mechanism. It is the regulator, the natural brake that controls how quickly sugar enters your bloodstream. When you extract the juice and remove the fiber, what remains is essentially a sugar delivery system with a vitamin C label on the carton. That glass hits your bloodstream within minutes of drinking it, compounding the glucose spike already arriving from the cereal, and together they create what researchers call postprandial hyperglycemia, elevated blood sugar after a meal, in which is a documented, independent cardiovascular risk factor directly associated with accelerated arterial damage and elevated inflammatory markers. There is another layer that almost nobody hears about because blood sugar is the part that occasionally gets discussed, even if not thoroughly enough. But something else is happening simultaneously that does not appear on a standard fasting glucose test. After a high sugar, high glycemic breakfast, your triglycerides spike. Not your fasting triglycerides, which is what your doctor measures at your annual checkup after 12 hours without food, but your postprandial triglycerides, the fat circulating in your blood 3 to 4 hours after a meal. A study published in the European Heart Journal found that postprandial triglyceride levels are a significantly stronger predictor of cardiovascular events than fasting triglyceride levels. Stronger, more predictive of actual outcomes, and almost completely overlooked in standard clinical practice because the test is not part of the routine panel. Eleanor's fasting triglycerides were within normal range. Her postprandial triglycerides, when we actually measured them, were nearly 3 times as high, and for 6 years, no one had ever questioned her breakfast. Now, I want to address the low fat component because this is where the story becomes genuinely frustrating to me. When you remove fat from a food product and still want it to taste like something, you have to replace that fat with something else. That something is almost always sugar, modified starches, or both. The low fat version of nearly every breakfast food is higher in added sugar than the full fat original it replaced. And that additional sugar compounds everything I have already described: more glycation, more postprandial glucose elevation, more triglyceride accumulation. There is also an additional problem. Dietary fat in appropriate quantities naturally slows gastric emptying, which moderates how quickly the rest of a meal enters your bloodstream. Remove the fat and you remove that natural buffer. The sugar arrives faster, the spike is sharper. You have taken the brake off the system while simultaneously pressing the accelerator. Then there is the whole wheat toast, which feels like such a modest and responsible choice. Here is what most people do not know. The glycemic index of most commercial whole wheat bread is nearly identical to white bread. The grain has been milled with the bran and germ reincorporated, but the structural integrity of the original grain is gone, and the glucose response is almost the same. 2 slices of whole wheat toast with low sugar jam means more glucose, more insulin, more arterial wall stress, compounding meal after meal, year after year, without a single outward symptom to suggest what is accumulating. So, what should you actually eat? When I changed Eleanor's breakfast, I was specific, because vague advice serves no one. The cereal box went away. If she wanted oats, she cooked whole rolled oats herself, not instant, not from a flavored packet, topped with walnuts and blueberries and no added sugar. The orange juice was replaced with one whole orange, all the fiber intact. The glucose response is categorically different, and she could feel it within 2 weeks: steady, consistent energy instead of the spike followed by a crash that she had come to accept as normal. The low-fat milk was replaced with full-fat milk or plain whole milk Greek yogurt with nothing added at the bottom. She put her own blueberries in and controlled exactly what went into it. The toast was replaced with 2 eggs cooked in real butter with whatever vegetables she had on hand: spinach, mushrooms, cherry tomatoes. Eggs have been substantially rehabilitated by the research of the last 15 years. They provide choline, which is essential for brain and cardiovascular membrane health. They deliver high-quality, complete protein, and they do not spike blood glucose. The postprandial response to eggs is entirely different from a bowl of commercial cereal. The protein question deserves more attention because it matters more after 60 than most people realize. After 60, the body becomes measurably less efficient at using dietary protein for muscle repair and maintenance, which means the requirement goes up at exactly the time most people are eating less of it. A breakfast that is high in refined carbohydrates and low in protein reinforces precisely the wrong nutritional pattern for this stage of life. Muscle loss, clinically called sarcopenia, is directly associated with frailty, and frailty is one of the strongest predictors of cardiovascular complication and mortality I have encountered in 25 years of surgery. Breakfast is not just about blood sugar, it is about whether your body has the raw materials to maintain the systems that protect you. Beyond removing what is harmful, there is genuine evidence for what actively helps. Blueberries, The anthocyanins that give them their deep color are among the most potent arterial wall protectors in the food supply, and a study published in the American Journal of Clinical Nutrition showed that daily blueberry consumption over 8 weeks produced measurable improvement in arterial function in people with elevated blood pressure, real documented reduction in arterial stiffness from a food, not a drug. A small handful of walnuts at breakfast provides plant based omega 3 fatty acids, arginine for nitric oxide production, and a sustained energy release that does not spike glucose. 1 tablespoon of ground flaxseed, ground not whole because your digestive system cannot extract the active compounds from whole flaxseed, added to yogurt or oatmeal contains lignans with measurable effects on blood pressure and arterial inflammation. And coffee for people without arrhythmia or specific cardiac contraindications, the current weight of evidence suggests that moderate consumption is not harmful and may carry meaningful benefits. What is harmful is what most people add to it: 2 spoons of sugar and a flavored creamer. Black coffee or coffee with a splash of full fat milk is a different thing entirely. 6 months after we changed Eleanor's breakfast and ran the specific tests I recommended, her postprandial triglycerides had normalized, her inflammatory markers had dropped measurably, and her cardiologist called it an improvement he had not anticipated from a dietary intervention alone. Eleanor called me from her kitchen and said she felt better before noon than she used to feel all day. I have not forgotten that. Here is exactly what I want you to do tomorrow morning. 3 specific things, nothing vague. First, before you eat anything, look at what is actually in your breakfast. Not the front of the box, the back. Find the total sugar content and the ingredient list. If sugar, corn syrup, maltodextrin, or any close variation appears in the first 3 ingredients, that breakfast is not protecting your heart, it is stressing your arteries. That is not a judgment, it is a mechanism, and now you know what to do about it. Second, remove the orange juice and replace it with the whole fruit. The fiber is not a bonus feature, but it is the entire point. Juice without fiber is a marketing story printed on a cardboard carton. Your arteries are not interested in the story. Third, add protein to your morning. 2 eggs cooked in real butter with whatever vegetables you have is the simplest answer. If eggs are not possible, plain whole milk Greek yogurt with berries and a tablespoon of ground flaxseed. The goal is a meal that does not spike your blood glucose, that delivers protein your body genuinely needs at this stage of life, and that gives your arterial walls something that supports rather than stresses them. One important thing before you go: everything I have shared today is grounded in published research and in my clinical experience as a cardiothoracic surgeon. It is general information, not personal medical advice tailored to your individual situation. Your medications matter, your specific history matters. If you have diabetes, kidney disease, or are managing multiple conditions, bring this conversation to your own physician before making significant changes. And when you do, ask specifically about postprandial triglycerides, ask about inflammatory markers, and ask whether your breakfast is serving your cardiovascular system the way you believe it is. That conversation, informed, specific, and direct, is where better outcomes begin. Your heart has been working for you since before you drew your first breath, every single morning, without ever taking a day off. The least we can do is give it a better breakfast.